You can send it around to people who missed this, if they have questions, if you have to drop off for any reason. So yeah, let's get started. You want to pull the presentation up, and we'll again, this is not meant to be formal, so please, if something doesn't make sense or you have questions, please ask. And Patrick, why don't you start off?
Yeah, thanks, Doug. Thanks, Julia. Hey, everybody. Good morning or good afternoon. I guess it just flipped to noon. We're going to just keep this kind of conversational, and the agenda today is to just make everybody aware, as the title says, that there's a better way for benefits. We've been working here at Hero Health on I guess, designed by and for a mid-sized employer plan. What does that mean? Well, our goals were pretty lofty when we started. We were very fortunate to be working with Catapult from the beginning on how could you possibly deliver better care to employees, lower cost to both the people and the plan, and give more control over to the CFO and HR departments so that they could get a better read on the data that, is often hidden from them, sold to others in many cases, and not shared. So our three goals there were the 3 C's, we call them: better care, lower cost, more control. And so we designed that health plan from your perspective as a mid-sized employer. This has been, used before, but we kind of said that, you get stuck doing the same thing over and over again. Everyone's busy. Everyone's real busy in the fourth quarter. So we appreciate y'all carving out a little time for us. But as Albert Einstein said, that, the definition of insanity was doing the same thing over and over and expecting a different result. And we often find in talking to employers, especially busy executives and employers, that they've been doing the same thing over and over again, and maybe not expecting different results. A lot of them have frankly given up on improving things, but just trying to do the least amount of damage. And we found that to be a real challenge. And so that's what part of what Hero addresses is getting better results from doing something a little bit different. And we work with a lot of companies. We work with advisors. We work with HR departments, executives, CFOs, CEOs, all over the board, with associations, with nonprofits, for-profits, every kind of company you can imagine. And they're all kind of similar in that sitting in the boardroom, it often looks a little bit like this, where, we've kind of accepted that healthcare costs keep going up and up and up, and benefits get trimmed, maybe not every year, but every other year, something's cut. And the impact on company culture is not often understood. It's understood by y'all, but a lot of times by the decision maker or the CEO, they're not fully informed as to how this impacts retention, recruiting, reputation, and company culture. And it's all intertwined, as you know. And so what's going on in the lately, and Doug and I talked about this, and Julia a month or so ago, but Mercer came out with a survey of 700 mid-sized employers, and the results were kind of surprising. They weren't shocking, but they're kind of surprising. And you can see them all here. But basically, coming out of COVID, where everyone kind of tapped the brake or slammed on the brakes on things, now fully 70% of employers are enhancing their benefits going into next year. That's way, way, way ahead of where it was in 2019, 2020, 21. Only 14% said they have no plans to improve benefits. And so with inflation running rampant, and it's really hard for companies to pay raises that are equal or better than inflation, those smart companies have turned to benefits and said the least we can do, or the most important thing we could do perhaps, is improve our benefits. And so that's a challenge in the face of rising costs. What are you going to do? But this is a recent study. We thought we'd share that. And then Doug, I'll turn it back over to you because, as you guys have been on what we call the merry-go-round, we've got a slide for that, and kind of what you went through in your process. And there's the merry-go-round picture that probably resonates with a lot of members.
I'll talk as Catapult as an employer. 55 employees on our plan, about 80 employees total. And so, we were, for most of my career here, we're fully insured. and every other year or so, I've had all the insurance plans in my career here, all the name, all the logos. But in the last 10 years, you saw a shift in that we really starting to get aggressive with, it's like Patrick said, cutting benefits. And what that really meant was raising deductibles, raising copays, a $500 emergency room visits, things like that. And then we got cute at some point about 4 or 5 years ago and layered in a healthcare reimbursement account so we can go out to the market with a $5,000 deductible, but our employees only had to pay $1,500 of that. So again, but that was really kind of our only levers through all that was, raise the premiums, raise the deductibles, raise the copays. That was kind of our lever. We had a few, ancillary wellness things we did, but they really didn't work. I mean, it's like the same old thing. People already going to the gym and eating well came to the wellness activities, but the people that were not doing well did not come to them. So didn't really move the needle on that. And so then about 3 years ago, really another path we're on, which is trying to help our members. We started looking around the country for, is there not a better way with healthcare? Because we hear the same story from our members, it's merry-go-round. Every 2 or 3 years, you change carriers. They come with some crazy increase, 20%, and we beat them up and they go down to 10%, whatever. And so we looked and looked, and most of the models that we saw around the country that claimed to be innovative were really just ways to play with the money, move the money around, the finances around. As Patrick's always told me, as have others, really the finances is 25% of this. The bulk of the cost is with the claims. We didn't find any model out there that actually addressed the claims cost and really tried proactively to really move that down until we met Hero Health. Hero is part of this Health Rosetta structure around the country. This is even Hero is our local version of this. This is a national program that's it's modeled after. And so we jumped on. We became a client over a year ago. And our first year, our costs were down 25%. Now that's not guaranteed, obviously, but we had a great year. I think something like 75% of our employees used it. So it wasn't like we had you had no help. We had help, we had claims. But the cool thing about this plan is that we're self-funded. Even at 55 employees or so on the plan, we are fully self-insured. We have stop loss to cover, the bad events, but we're fully self-insured, which gives us more control. Our employees love the plan. We have a nurse navigator they like, a pharmacy navigator they like. So that gives them, my daughter now who's pregnant for the first time has been ecstatic having a nurse to call for doctors, for advice, for, hey, what does this result mean? All that kind of stuff. And so it's gone well for the employees. We're happy because our costs are down. For us, 25% is about $200,000 a year. So on a $700,000 budget, we save $200,000. That's a big deal to a company our size. So I'll stop there. But again, in our first year, very, very happy with the results we got, both from a employee happiness standpoint and from a company happiness standpoint. So.
Yeah, that's great, Doug. Thanks. That's the real world stuff is most important. And I'll get to this slide in a minute, but I just got off the phone or off a Zoom with a 80 employee group in Mount Airy, Winston-Salem, Mount Airy area. And they were struggling like so many others, like y'all, about the same size. And have tried every horse on the merry-go-round, as we say. And what they were most surprised at with our program was that you can choose, one of our programs is you can choose a level funded approach. And so they're used to paying, I think, $50,000, $60,000 a month, I think is what they're paying to a fully insured program. And our quote came in at the same price. So they're going to pay the same amount, $60,000 a month, except at the end of the year, if they were fully insured, any profits become profits of Blue Cross or United Healthcare. If you're level funded, you split any remaining money with Cigna, usually level funded, you split it 50-50 with the carrier. But with us, any profit left over, any unspent funds at the end of the year becomes your profit. And so just like Doug, y'all's plan saved $191,000 in the first year, that money doesn't go to us or Cigna or MedCost or Blue Cross. It stays with the company. So that helped fund new benefits for Catapult during these tough economic times. And so this company was astonished that, they get to keep the money. They're not used to hearing that. But that's the second best part about it. I think the best part about it is what Doug alluded to, that having that proactive approach of adding and replacing a website like bluecross.org or cigna.com with a real person that cares, a nurse, is a huge steep leap forward in customer service. So to have Doug's daughter or anybody else on the Catapult plan be able to reach out, and we started sending these out now, where we do refrigerator magnets for all these with the nurse's picture and her HIPAA secure line on it, to get in touch, and also business cards for your purse or wallet. We send these welcome packs to the house so that the spouse always hears about it too, because often they're not informed as much. But just doing all of these things to get more engagement with the employees and their families, because that's what we found out really optimizes the health plan. So all the best work we do on, tweaking deductibles or copays or, getting special arrangements for centers of excellence or second opinions, it just goes unused unless you have engagement with your employees. And we found the best way to do that is not through me talking or Doug sending out a flyer or email, but having a nurse navigator engage with your people, so you develop those relationships, especially with those with chronic conditions. They need the most care. So if you have somebody with cancer or diabetes, or maybe having surgery that week, or first pregnancy, anything that needs a hand holding or a human to human engagement is super important to have, instead of a website or a 1-800 number. And that's been a big part of the success of the plan. But getting that out, this is, just kind of standard issue stuff we talk about. It's kind of, what did the standard or the typical CFO looks for versus an HR professional. Often the same, but sometimes a little different perspective on costs and care, or what kind of data they want. But we provide all of it to you. And so you really get you get alignment in the C-suite, as we say, because we're helping both sides of the equation there. The finance team is really happy getting control of the data and cost. And the HR team is really happy because they can offer more things that increase retention, recruiting, reputation, stuff like that, with zero out-of-pocket options, and making the plan more understandable to the employees. And that's really important.
We had a question before we get into the how the plan works, so just around size. What size do you have to be in this plan?
Yeah, so that's a great question. Thanks. By statute, in North Carolina, you need 26 eligible, which is hard to translate because nobody purchases risk based on eligible. It's all on enrolled. So we say 25 enrolled employees on the plan is the threshold to do something like this. And we hope that number goes down over time. But right now, right now, that's what the number is. 25 employees on the plan is what you need to qualify. That's a good question.
That's employees, not people. It's employees on the plan.
Yeah, we call them EEs, or enrolled employees on the plan. So if you have 30 employees, but only 22 are on the plan, that wouldn't qualify. But if you have 26 employees and 25 are on the plan, that would qualify. So, and we'll work with you. Once you get above 50, it really becomes a lot easier. And it becomes, again, a lot easier when you have 100 or more, because you start getting all your data, or we can help get all your data if you're over 100. We still run into companies that have 100 employees and their carrier is not sharing data with them, which is illegal. Under 100 in North Carolina, the powers that be at Blue Cross leading the charge, have passed rules that that allow them to block your data, which is crazy. But we give it all to you, whether you have 2,500 or 25 employees. All your data is your data, and we share it with you. We don't sell it to anybody like others do. So another, we're going kind of high level here, but another important thing to remember is, we get this question a lot. I'll talk for too long, as you can tell, and then somebody will say, "Oh, it sounds exciting, but I bet it's crazy. Is it an RBP or is it an HMO? Is it a narrow network? I bet it only works with the folks that they're already contracted with." And none of that is true. We're a regular old PPO at base. So in other words, the logo on your card is going to be really familiar to your employees and to all the providers in North Carolina, South Carolina, Virginia, and beyond. We work with MedCost, PPO Network, and also Cigna. And so between the two of them, you can choose, and we can get you 100% access to hospitals, 98, 99% access to providers. There's always a few providers that don't join a network. My next door neighbor in this office complex is a counselor, a mental health counselor, and she only belongs to Blue Cross, but she accepts direct contracts from us for if we work with her. So in other words, you'll never get to 100% of providers, but you'll be at 99% with either Cigna or MedCost. And so you get access. And then you can see the rest here. We contract with centers of excellence. What does that mean? That means a facility like an Ortho Carolina, let's say, in Charlotte, Hickory, Greensboro, Winston-Salem, that has top 5% surgeons in the cleanest facility with the best outcomes, very low readmission and complication rates, high safety ratings, all that kind of stuff. So top doctors and top facilities like Raleigh Ortho in this area in Raleigh, RTP. We contract with them where you pay a fraction of the price and you get the highest quality doctors. And you also get all your data, the navigators, and lots of zero out-of-pocket options. So this is kind of a comparison chart for you. We're going to hand this out. Julia is going to be able to send this to y'all. So, because I know I'm going kind of fast.
Yeah, but that's the thing that our employees love the most is that, it starts with a PPO. So this is not some weird thing. A lot of the models we looked at around the country were weird things,
Yeah.
Oh, we're only going to pay for these kind of charges, or you have to go to this small network, or we're going to fight with lawyers over paying bills and whatnot.
Yeah,
and
or there's no network. You just go to the hospital and try to get in.
Let the lawyers fight about it. So this is a PPO. For Catapult, we use MedCost in this state, so it's a name brand PPO. And employees could just choose to do nothing with Hero and just go to the PPO and go wherever they want to go. Show that card. It's like everything else. Boom, done. Hero sits on top of that. So for those that choose, like we had an employee spouse who had a knee replacement, whatever, the whole thing was free for him. Yeah. Now, again, try to talk to your employees about that. Oh my gosh, how is that? Because what Patrick just said, we end up paying half the rate that you would have otherwise paid. So that's the cool thing that our employees like. It's kind of both. You have the security of the PPO, but you also have this cool thing sitting on top of it that a nurse helps you navigate, that you can get like 19 or 20 categories of stuff. Like my medicines are all free. I don't pay for any medicines. They're all free. I'm getting older too, Patrick. It seems like every decade adds a pill, right?
Yeah, so, that's right. That's right. I hope to make it to a lot of pills one day if that's the case. Yeah.
But they're all free for me. They're all free, and that's the employee.
Oh, you went to mute there. Yeah, you got it.
That balance of security with also innovation. But I can decide as an employee which way I want to go, as opposed to now where the carrier makes all my decisions for me.
Yeah, that's important. And this is a little cartoon that we do that kind of makes sense. If you pay attention, you got to kind of look at it a couple times. The vast majority of employers are on the left-hand side. And so that's where big pharma, that's like Optum, Express Scripts, they're all owned by the BUCAs, by the Blue, United, Cigna, Aetna of the world. And they all work in cahoots with each other. They're passing money back and forth. They get sued all the time. If you Google United Healthcare lawsuit, you're going to see 5,000 lawsuits. If they're always in trouble, but they're making so much money they don't really care. They hide your data, blah blah blah. You know how that all works. And then the hospitals are partnering with them because they have to. Kind of, the hospitals are not bad, but they get told what to do by Blue, United, Cigna, Aetna. The hospitals didn't come out with $5,000 MRIs. That they were told to charge that by Blue, United, Cigna, Aetna. That's what they can get away with. So the hospitals are, kind of complicit in a lot of that stuff. And we don't have enough time to talk about the history of MLR and how we got here. But let's just suffice to say that you don't need to stay in that system of hospital, PBM, middleman tower. There is another way. And when you cross over the bridge, which is self-funding, you get to our side where you work with local pharmacies that charge $0 for 310 generics. All Harris Teeters are $0. Kroger's all $0. 610 local pharmacies in North Carolina are $0 cost for all of our members. You go to surgery centers that are much cleaner, smaller, and staffed with better surgeons. We've got all the data. You go to primary care instead of going to the ER and spending $3,000 for a Pepsid AC at Duke. You can go to primary care doctors and actually take care of whatever's, troubling that person. It just goes on and on. It's just, somebody said this is the plan you want your mama on, and I agree, because we reveal all the quality data, we steer you to the right places. But it's still your choice. If mama wants to go to Duke because that's where she wants to go, you're free to go there. You're just going to pay a higher rate. You're going to pay the same rate you always paid, right? But if you call the nurse first and she finds that she can get you an MRI for $0 cost at Raleigh Radiology or Ortho Carolina or wherever you are in the state, or she can get you $0 out-of-pocket PT or at hundreds of locations, or $0 out-of-pocket surgeries, because you're choosing wisely, we call it, you're choosing the higher quality, you pay $0. And then that begs the important question, who pays for it? It's not $0. It's not a giveaway. Well, the savings are so significant that the company can give it away. I have an example here. So you can see at the top, a typical knee replacement is actually going to be higher than $48,000 today. If you go to Wake Med or Novant, it might be $68,000 for a hip or a knee replacement. But with us, it's actually $23,000. The member pays $0. The plan pays the rest. Because the plan saves so much money, we pass that savings on to your employees. So it's a win-win-win. A win for your employee who paid $0 for a top doctor doing their knee surgery or hip surgery or whatever it is. It's a win for the plan because the plan saved $25,000 to $55,000. It's a win for the top doctor because the top doctor just got a new patient. The top doctors, when they work with the Blue, United, Cigna, Aetna, it's like a dealer at blackjack. They just get the next referral. Sometimes you get the best doctor, sometimes you don't. And so with us, we only use the top doctors in our program. And so we always are giving more business to the better doctors. And so that's important to remember. I know we're going kind of fast, but I'll get to the heart of it right here. Doug already alluded to this. We take your plan and we don't throw it out. We just add a column with all these $0 benefits. So you can go to imaging centers, telehealth, all the stuff on here, urgent care, durable medical equipment, sleep studies, lab work, PT, counseling sessions, addiction services, second opinions from Mayo Clinic, whatever it is. Because we're saving your company, your plan money, we pass the savings on, a little bit of the savings, to the employee and incentivize them, don't penalize them, incentivize them to use the service that's a better price and higher quality value. And so it's a virtuous circle that starts. And so we call that the power of $0. And I've been flattered that I've seen other people take that and use that in their marketing too. So somebody,
And we tried
several.
over the years, like many of you, to get employees through consumer-driven health plans and incentives and
Yeah,
discount cards and whatnot. We just found, I mean, people are generally irrational when it comes to their own health care, and even less rational when it comes to their children's health care. And so trying to get them to think like they think when they buy a car or a washing machine is just not the same. And so we have found, though, at least for our employees, this power of zero does get people's attention almost to the other extreme. I thought you said everything was free.
I know.
Well, the
We
point is, this got their attention. Let's dial that back. No, everything's not free. Braces are not free, for example, like everybody wants them to be. But I mean, these 20 things are, if I choose to use it. It's been that's been we had a lot of use from our employees here.
Yeah,
Uh,
and the way we pay for that, Doug, is important because as you see, there's what we're taking advantage of are anomalies in the market. So take for instance lab work. We had a CEO of a company that we work with, and they're a Catapult member in Raleigh, and the CEO went to UNC and got a bunch of lab work done, and he thought the lab work would be free. Well, we told him you had to, call the nurse first and that kind of stuff. Well, it was 500 and something dollars. The same exact lab work at Quest, LabCorp, or Mako, which he passed on the way to UNC, they're all over the place, those labs, would be zero for him and would cost the company 140 or $150. And so just like Raleigh Radiology, it costs $650 for any of my clients to get an MRI at the best machines in North Carolina. MRI machines at Raleigh Rad and top doctors, $650. So we insist that Catapult charge their clients zero, their company members zero, their employees. That same MRI across the street at Wake Med might cost $6,500. It's the same equipment. It's 10 times more expensive. So you need, no matter how smart y'all are, you need that nurse to navigate this in order to take advantage of these, discrepancies in the marketplace. And we've just put them all together, and then having the nurse help your client, your members, your employees get there is the important part, because there's nothing worse than having all these good deals and having no one take advantage of them, right? So the nurse is key in getting the batting average up so that people actually use all these programs. I know we're going fast. We've got some questions. I'll go through this real quick. Here's a problem that I see in a lot of employer groups in North Carolina, and especially the mid-sized groups, those with 25 to 2,500 employees, the heart of the Catapult market. There's not a great appreciation for the ratio between what you're spending in fixed costs, admin, insurance, and what you're spending in variable costs. What Doug alluded to earlier, claims, medical claims, and pharmacy claims. I pulled this out of one of our groups we just quoted recently, and you can see how we break this down. So they're spending 10% of their total dollars for healthcare on admin. That's paying your broker, your telehealth, the nurse, 10%. They're spending 14% on insurance, their stop loss to prevent any, cover them on high cost claims. And 76% is going to hospitals, doctors, surgery centers, and pharmacy. And so when they saw this, their kind of eyes got wide and they were like, oh, I get it. We're gonna increase our admin from 100,000 to 120,000 or 110,000 with you, but that's going to help us reduce our claims from 810 down to 510. So we're going to spend just a little more on admin to save hundreds of thousands on specialty drugs, branded drugs, surgeries, imaging, all the rest. And so it's not a one-to-one thing. You really need to understand, I know y'all do, but it's good to appreciate the difference between a fixed cost being small and a variable cost that's huge that can be impacted. And so that's just what that graphic's about. We talked about the contract. I should have started with this. This is how it all works together. We take in all your claims, prescriptions, medical claims of all kinds, just like Blue Cross, United, Cigna, and Aetna do. They have the same software we do on predictive analytics. The difference is we actually use it to help people. We don't wait until somebody's sick and then call it a claim and ask you for money to pay for it. Instead, we organize your people in your plan. You can see, kind of barely see it there, the red bodies, yellow bodies, and green bodies. The red bodies are chronic condition. That's somebody that needs that care, right? They're going into surgery this week. They have cancer, or they're a survivor, or they're diabetic, and they need a health plan. They need that communication, a care pathway. The yellow bodies need navigation. That's somebody who needs an MRI, or is going to PT, or maybe is looking for a new OB. So predictive analytics will help us organize who needs what. The green bodies are somebody who's not generating claims, and so they just need a monthly touch, like a health bulletin and stuff like that. That's the information that we have. The education piece is the second platform. We talked a little bit about it, but we have all the providers in America ranked by volume, outcomes, complexity, accreditation, and loyalty to facility. It's called a vocal score. Now, if you're going to Duke right down the street here and you're getting a knee surgery, there's probably 25 doctors that operate on knees at Duke. A few of them started July 1st. They've done about 3 knees. A few of them have done 3,000 knees. Wouldn't you like to know the difference if you're getting a knee surgery done at Duke between the one that's you're his 4th knee, or first? On July 2nd, he did his 1st knee. Wouldn't you like to know who's got the highest outcomes? Patient reported outcomes. So 90 days later, the patient reports that they're happy with their knee replacement. Would you like to see somebody who has a 95 score, or the guy who has a 9.5 score? Because they're both at Duke. If you just walk in and show your unlimited credit card and walk into Duke, you could get a great doctor, you could get the worst doctor. Guess who has more availability? The worst ones. Yeah, so our provider platform rates all the doctors in America because they have to report their volume, outcomes, accreditation. Are they a fellowship doctor? Are they board certified? Or did they barely graduate from med school and that's it? You still call them doctor, right? And so we know the difference between the best doctors and the mediocre in America. We also have all the facility ratings. Which facilities have the highest COVID rates, complication rates, safety violations? Leapfrog, our service, even goes into the hospitals and sees who's washing their hands the most. These are all related. And so, Wake Baptist, for instance, had a C rating for high infectious diseases. I wouldn't send anybody there, until they get that up to a B+ or an A- again. I wouldn't send anybody there. You have a 1 in 15 chance of getting a new disease if you walk in there, So you've got to be really careful about providers and facilities. We have all this at our fingertips. Now, the good news is in North Carolina, we've got great doctors and top-notch facilities all over the state. There's really good care here. But the difference between getting a C+ doctor and an A+ doctor, Blue Cross, United, Cigna, Aetna will never share that with you. We do daily. And again, wouldn't you want your mama to be on the best, see the best spine doctor in Winston-Salem, or the top hip doctor in Charlotte, or whatever? And it's all done through a nurse. Thankfully, it's not me. It's a nurse that's helping you all out. And so that personal service to help with these kinds of things is how it works. And then we just go out and get direct contracts with those top facilities. When we see somebody is performing at a real high level, we call them up and we ask, do you want to work directly with us? And so that's how that works. This is like the last slide or so. I just wanted to say that, like Doug mentioned, we protect the plan first. A lot of companies we work with are moving from fully insured or level funded, and they're very nervous about that. The company I just got off the Zoom with this morning, with 90 employees, it's family owned in Mount Airy, they are moving from fully insured to our plan. They're very excited to hear that the payments will be the same. They really wanted to know about the protection. What if we get a terrible accident in month 2? What happens? Well, you pay the same amount every month, and you won't have any money left in the bucket at the end of the year, but your responsibility doesn't change. So if you're paying $50,000 a month and you get a $500,000 claim, you don't owe 500. You owe $50,000 a month for 12 months. At the end of the year, there won't be any money left over for you to not, like Catapult had almost 200,000 left in their account. Every once in a while, you're going to have a terrible year like that, but you don't owe more than what you're paying in. There's no collateral or capital calls or anything like that. What it is just a set amount. We call it smart funding. And that's really important to understand. The other thing that people get confused about is we had somebody, and Doug, I know you've gotten this question before, where people said, I don't have time. My HR doesn't have time to pay every darn bill. Like they're going to have to pay every Band-Aid and every bunion and everything in between. No. You don't have to do anything like that. You write one check a month from your ledger to your checking account, your health checking account, and then the TPA pays all your bills and reports it back to you. And so you're writing one check, just like you do now. You send it to Blue Cross or United or Cigna or Aetna. You're going to just send it to your own checking account, and the TPA is the only person that has access to that, and they pay all the bills. They pay your broker, they pay us, they pay the hospitals, they pay the drug, they pay all the bills and give you the reports to prove it, to square up. And so admin is easy on these plans. So those are the two things that there was confusion about, I thought we would address.
We have a question as well around, so what happens, where is the stop loss covered, and what happens when you have that, what do you just call it, biblical year?
Yeah. I don't know if I'm supposed to say that, but yeah, I've said that before. Yeah, and those happen, right? You buy insurance for the unexpected, and so unexpected things are going to happen. But yes, so the stop loss, the way it works is they're looking at your group, and let's say you're paying $50,000 a month to a Blue United Cigna. Okay, your price for this is going to be real close to that. Might be a little bit under, might be right on it, might be a little bit over, but let's say it's right on it. At the end of the year, if you're fully insured, Blue Cross keeps any profit. If you're self-funded, Blue Cross keeps, if you're level funded, Blue Cross keeps half the profit. But if you're with us, you keep 100% of the profit of anything left over. That's the important thing to remember, is all of them protect your plan, but one of them allows you to keep all of the money is your money. The data is your data. That's the big difference on those two things. And then the third thing I would say that's important is, if you get that high cost claim, like somebody told us, hey, we got this terrible cancer and we were self-funded and we're really scared and it's $1 million. And I say, wow, that's terrible. But if you're self-funded, the stop loss carriers are not trying to make up for the past, like Blue Cross, United, Cigna, Aetna, which is going to charge you 30, 40% higher, 50% higher next year. The stop loss market is an open market. It's kind of like getting a mortgage for your house. You can go to a different stop loss carrier and they're going to look at the future, not the past. They're going to say, is that claim settled? Is that person cured? Are they off the plan? And then they're going to treat you like a new client and give you the best possible price. If you're with the BUCAs, as we call them, Blue, United, Cigna, Aetna, they often build in, they're like, hey, we lost money last year. We're going to charge you more next year. And so we see a big difference there between traditional plans and stop loss when it comes to a high cost claimant, and how is it priced the following year. And that's really important.
And who's it with, stop loss coverage?
So we've got 4 different carriers that compete with each other to get the best price for our clients. And so there's a couple of them that are familiar names, Pareto, East Coast, Skyward, Roundstone. Those are the big 4, but there's others. But yeah, the stop loss market gives us a better price because we lower their risk too, right? We're aligned with them. And so we've had brokers call in and say, hey, I want to get a price on my group. And then we call in a week later and find out from the stop loss carrier that the broker's already called in and the broker gets upset because our price is lower. Well, it's lower because the risk is lower because we're doing all these proactive things. And
That's
so,
one thing I was thinking from a employee standpoint. It's really different here is that we've had a lot of high cost drug claims at Catapult,
yeah,
where it was going to be $100,000, $150,000 a year, whatever. And, instead of just giving the employee a 10% discount card, in this case, in the best case, they've got it reduced to zero through prescription assistance. In other cases, cut it in half, import from Canada, et cetera, et cetera. The point is, both the employee feels that, but the stop loss carriers also know Hero's
yeah,
not just going to accept that $100,000 Humira or whatnot, just go, just pay it. They're
yeah.
going to fight it. Again, it doesn't affect the employee. It's covered, but the amount we pay is what they're going to get behind the scenes and work with various people to get that reduced. So it's a whole different world than just kind of just pay the claims, accept what comes in. Then year end comes, let's true up for next year, which
Yeah.
is what we're all used to in the healthcare market.
Yeah, and you're absolutely right. It's especially true on the specialty drugs. That's the lowest hanging fruit. Like we just got off that call with that mid-sized employer, and he said, and he's on the board of a hospital, and he said, "I love this. I want to introduce you to my hospital." I said, "We'd love to work with them if they're willing to improve care and reduce costs for working people. We're all in." And so that was interesting. But the important, he said to me, "Where does the savings come from?" And that I said, "That's a great question. We don't hear that enough. The savings come primarily from the reduction in specialty drugs in the first year, and also in a few key surgeries and cancers in the first year. In the second year, it comes in combination of the engagement has helped reduce all those other things. So the engagement for MRIs and PT and all those other things goes way up as they get more familiar with the nurse and the program. It doesn't happen day one. Nobody on day one immediately goes to the gets it right at the MRI. We rarely see that. But as they engage with the nurse and get used to the program, we see the batting average go from 0 to 90, 95%. But the savings typically comes from the specialty drugs right off the bat, which can be significant. Humira costs $75,000 a year. And when we ask employees, how much does that Humira cost? They're like $5,000 a year. I'm like, no, total cost. They're like $5,000 a year. I'm like, no, that's what you pay. What does the company pay? And they're like, I told you $5,000 a year. I'm like, okay, the employee doesn't get it that they're paying $5,000 and the employer is paying $70,000 for that drug, and they're usually flabbergasted when they find out. But when we get it down to 0 for them, the plan only pays $10,000. So we pay $10,000 for the service that does all the paperwork to get that drug down to 0. But Express Scripts and Prime Therapeutics and Optum, they'll never do that because they're all getting money. They're getting extra payments as part of that $75,000. They don't sit on your side of the table. We do. And so you got to have somebody to fight for you on that stuff. That's what we do. Any other questions? I know we got a couple in the chat.
I answered most. I answered it. I could answer them.
Okay, got it.
Quite a few questions about, is this just North Carolina? I said, no, it's other states. It works best in these 3 states, but it works around the country.
Yeah, we work nationally with Cigna, which is the PPO that allows us to do all the steering on top nationally. MedCost allows us to do it in North Carolina, South Carolina, and Virginia because they're not in other states yet. And MedCost's price compared to Cigna in North Carolina MedCost is a little cheaper, not by a ton, but a little bit. And so we prefer to use MedCost. And plus they're local. They're based in Winston-Salem, they have relationships with the facilities and physicians in this area that are really strong. So that's the underlying PPO, but the important stuff happens on top, like Doug said, getting y'all to better care at lower costs for the expensive stuff, and the mid-price stuff is important. The last part is the the drugs, we do the zero out of pocket pharmacy at, lots of, like I said, all those Harris Teeters and everything else. The employees that we're getting feedback from love that they can go to a Harris Teeter or a locally owned pharmacy and pay zero for 310 or so 320 generic drugs, and that's made a big difference in their take-home pay. That's been important. So, well, that's a lot of information in a short amount of time. If y'all don't have any more questions, like I said, Julia will be able to send this out to folks, and we thought it would be this is the start of a conversation. As you know, Catapult is all in, dedicated, as being an education source, a resource for all your questions about so many things, including healthcare. And we're very happy to partner with them to help in any way, no matter what you're doing. If we can help you answer a question for an employee or navigate something that's difficult for your plan, understand the differences, what are your options that are available, we'd love to help. And so please reach out through Doug or Julia if we can be helpful in any way. In this murky world of health insurance, we'd like to be a resource for you. So we appreciate that.
Are there any questions? I mean, feel free to come off mute and ask it. And one I get asked a lot is, how do you go forward? And like when we got ours, we had our broker call Patrick. Hey, broker, call Patrick. And so we had 3 quotes. The broker had the quote from where we were in Cigna. Here's another quote, Blue Cross, and here's Patrick and Hero Health. And so that's how it works. I mean, and then we just got to compare and contrast, ask questions and whatnot. So I mean, it's not like it's some strange thing. That's how that works. We also asked quite a bit. Okay, this sounds too good to be true. I don't understand how you take that hip from 68,000 to 24,000. That doesn't make any sense. So our board chair is a CEO of a medical practice. Mm-hmm. And I sat in when Patrick and her met to talk about the contract. And what I learned there was fascinating in that she told Patrick, look, I've got a second floor up there that's full of people calling the carriers to get paid for the procedure, calling the employees to get paid for the deductibles and whatnot. And I spend, X percent of money a year doing that. And so with Hero, you're telling them I'm going to get paid in 10 days by Hero for the procedure, and the employee owes nothing. That's how I'll accept half, sometimes more. Off my right. It's just that's fascinating. Yeah, I'm not saying it's right or it should be that way. That's just the world we're in. And like I said, like the way Patrick phrased that, he takes advantage of those, whatever you call market, whatever you call them, imbalances or whatnot.
Yeah.
And they win. It's like the doctor wins, we win, the employer wins.
You think about it this way: these top facilities are spending 25% of all their revenue chasing after their revenue. So they seriously, like Wake Med, the CEO Don Ginsing told me, they've got a whole floor dedicated to calling employees to say, hey, you're falling behind on your payment for that knee. You owe us $5,000. You only paid $1,000. When are we going to get our money? They got to, and we get rid of all that. There's no more hassling employees and their families, and there's no more calling up Blue Cross asking for the other $50,000 they owe you. So we get rid of all that, and so that's why they reduce their cost for us. So that's how it works. But we really appreciate all the time, and we'd love to. Somebody asked me privately a little while ago, can we keep our broker? Absolutely. You can keep your broker, and if you don't want to keep your broker, we can get you a broker that's highly recommended because we know the best brokers. So whatever the case fits you, keep your broker or look for a broker. We can help and work with that. If that's a question that some of y'all might have in the back of your mind.
Question about, does this work with manufacturing?
Yeah, we work with construction, manufacturing, nonprofits, school districts, county governments. Basically where it really works is with working people, working families that have some sort of pressure on wage, and wages. If you're printing money in RTP with some, tech company, SaaS or whatever, you're probably not that interested in saving that much or working extra on your health plan savings. although we'd like to work with them. but but we really shine with folks that are under a budget and that have employees that need navigation help or could benefit from navigation help instead of going to a 1-800 number. Those are the two big things.
I have a question. I asked a question in reference to the employees in North Carolina. I have employees in 9 different states with also in California. So my question, I know you said North Carolina, South Carolina, and Virginia, but then again, my question will be how would this work in California, and then also outside of, again, North Carolina, South Carolina, and Virginia?
Yeah, that's a great question. So with a company like yours, we use Cigna nationally. So we cover 100% of the US, and we've got contracts with, while we have more contracts in North Carolina, South Carolina, and Virginia, we definitely have more. We have national contracts. So for 2,400 imaging centers and 7,600 PTs, and just all over the country with surgery centers, orthopedic, all that kind of stuff. We work nationally. We do have more direct contracts in our area just because we live here. We know the folks here. So yeah, we work nationally. The PPO would be Cigna, and then we would the drugs work nationally. The local pharmacies are national. The specialty meds are national, international. So all of that stays the same. We just have a few extra contracts around here, like with the Raleigh Radiologies or the Ortho Carolinas and stuff like that. But yeah, we'd love to work with, or we could get you an illustrative quote if you wanted to see something just at a high level, just here's my top 25 drug list, here's my census, how would y'all help me? And we would put together a little, like a 4-page report for you or something.
Okay, thank you.
Thanks.
How long does it take, Patrick, to transition from the current providers to Hero?
Well, we just finished a quote today. What's today, the 25th, and they start December 1st. That's a little tighter than what we used to. So that's really tight. I mean, we met with them previously, but they just decided today, and they're doing open enrollment starting on the 3rd of November. So we're loading everything up in Employee Navigator for them on the 3rd. They're going to finish enrollment on the 10th. We'll print their ID cards on the 11th, and they'll receive them by the 25th, and they'll start December 1st. That's a little tight, but typically it's not quite flipping a switch. But like if somebody met with us today and said, "Hey, we're interested," the comfortable renewal date for us would probably be February, something like that. Like, it's good to have a few months. We're talking to people right now that have July, and renewals in July and March, groups like that. So, I would say 6 months is ideal from hello. Hey, we're having renewal in 6 months. We'd really like to walk. We don't want to sprint. But, 3 months is a little tight, but we do that all the time. I hope that answers the question.
All right. A few last questions. I don't see any in the chat here. Well, again, thanks so much today for taking the time. Again, you'll get an email from Julia with the recording and whatnot, and again, and contact information. Would love to talk to you about, whether it be talking to Patrick, or if you want a case study through us, or just ask me, okay, what about this? What about that? What about? Happy to talk to you. And again, in this kind of murky world of healthcare. So have a great rest of your Tuesday. And again, thanks again for tuning in. Have a good day.
Thanks, everybody.